Obesidad, arte o ciencia, el impacto en la personalización del tratamiento. Dr. Robert Kushner, hablando con su paciente acerca del peso corporal.
Hello, I'm Dr. Robert Kushner. I'm a professor of medicine and medical education at Northwestern University Feinberg School of Medicine in Chicago. And it is my pleasure to present to you information on talking to patients about body weight. Talking about body weight is probably one of the most sensitive topics that we bring up to patients, particularly more recently when there's been a positive body movement among our patients. What is it that you see when you look at these images? Do you see a person in a larger body, a target of weight bias and stigma, who is accepting of their body weight and who is fulfilling a healthy and meaningful life? In other words, they're happy with their body. Or do you see a patient with obesity, which is a complex multifactorial chronic disease who statistically has a higher risk for increased morbidity and mortality and reduced quality of life? I think the answer is actually both. We want to recognize an individual's positive body image, as well as their autonomy to do what they wish about their body, and they celebrate their body. But as clinicians, we also want to reduce the risk that our patients face by having obesity. Therefore, the words that we use to talk about patients matters, and we need to respect the feeling that patients may have about their body. We need to be aware of what weight bias and stigma is. By definition, individuals affected by overweight or obesity face a pervasive form of social stigma based on the typically unproven assumption that their body weight derives primarily from problems of self-discipline or personal responsibility. They are very attentive to weight bias, which are negative attitudes towards them, weight stigma, which is stereotyping and labeling them, as well as frank weight discrimination, which are actions against people who have obesity. It's important as healthcare providers that we are aware of these potential societal issues, and therefore we're very careful in the words that we choose talking to patients and identify many of them harbor these feelings about their weight. There is a movement globally in the United States and Mexico that's called Health at Every Size. And what the views that they take is that rather than focusing on any measure of body shape or size, they encourage a fulfilling and meaningful lifestyle, which I would agree with entirely. It promotes positive health behaviors such as healthy eating and increased physical activity. And it's important that they are not labeled. So they're individuals who are of larger size rather than obese individuals. So we need to treat our patients with dignity and respect when it comes to their weight and ask them whether they desire weight loss as part of their health plan. You know, there's a technique that I use, which is called the weight life events graph, that you may find helpful as well in your practice. And if you have the time, by asking patients to graph their weight in associated life events, which is an autobiography, what it allows for is a self-reflection and introspection of their weight, new learning and self-awareness of the life events that cause them to gain weight, a reconstruction of their own story about how they gained weight, a deeper understanding of relationships of their weight to other life events. It often causes a diminished self-blame and increased self-compassion about their weight, and it also helps to guide treatment. Let me show you what an example of a weight graph looks like in a patient that I saw, where I just gave her this two lines. One is weight and one is time, and I asked this woman to simply record her weight journey over her life. And what you see are examples of college, marriage, and pregnancy causing weight gain. Later in life, she underwent menopause and personal illness and family illness and stressful job, and then ended up with a personal illness again, family death, stressful job, and empty nest. So by understanding her weight journey, you can walk in her shoes, so to speak, and have a better understanding of the meaning of her weight and use sensitive and empathetic language. So once we communicate with our patients about how they feel about their weight, we can then talk about the risks of being overweight and to educate them as such. In this diagram, these are medical problems you're all familiar with, are the types of comorbid conditions that are associated with obesity, such as depression, hypertension, reflux disease, metabolic syndrome, fatty liver disease, type 2 diabetes, and so forth. It is likely that many of our patients, particularly as they age, develop these medical problems, and we need to let them know that by controlling their weight and their health, they're likely to have a reduction in these risk factors or improve the diseases that they already have. We also know that as one gains weight by using this marker of body mass index, which is actually a measurement of body size, the higher the BMI, the higher the risk of mortality. And this is a study of 230 prospective studies over 4 continents. So although BMI may be insulting to a patient because it just measures body size, nonetheless, the data is actually very sound that the higher the BMI, likely the higher the body fat, the greater the risk of death and actually the greater the risk of mortality. So this is information that's helpful to convey to your patient and to explain to them why it is that you would like them to pay attention to their weight and potentially give them more guidance.
Le presentamos los avances de la segunda parte de nuestra sesión académica con el Dr. Robert Kushner.
Modest weight loss can have an impact on their overall health. This is hopefully some patients will be interested in. You can improve their glycemic control if they have prediabetes, reduce their triglycerides. We can increase their HDL cholesterol, reduce their blood pressure, potentially reduce fatty liver disease, and very importantly, increase their quality of life.
IFA Celtics, Salud Metabólica.